Welcome to our session on self-compassion training for helping professionals. I'm Lily Chen, a registered nurse and a PhD candidate at School of Nursing, Hong Kong U, with my research specializing in mind body interventions and practicing compassion-based approaches. Today, we'll be covering how self-compassion impacts our well-being, especially when working with people living with Parkinson's disease, their caregivers, and in our own professional roles. Here, what we will be covering today: an introduction to Parkinson's disease, the importance of interdisciplinary collaboration, the stress and burnout experienced by helping professionals, what self-compassion is and what it isn't, how can we cultivate self-compassion through practice, and finally, how to promote self-compassion for ourselves and those we serve. Let's begin with an overview of Parkinson's disease. It's a progressive neurological disorder. It's caused by the loss of neurons in the brain substantia nigra region, which leads to a drop in dopamine, a chemical crucial for regulating body movement and mood. This loss affects not only physical abilities, but also emotional and mental well-being. Here's a few common questions about Parkinson's disease. Does Parkinson affect only older people? Actually, no. While it's more common with age, it can also affect younger individuals, even those under 50. Is it just about movement problems? Again, no. Parkinson involves both motor symptoms like tremor and non-motor symptoms like depression, constipation, and sleep issues. Sometimes these non-motor symptoms appear before movement difficulties. Do we need an MRI to diagnose Parkinson's disease? The golden standard remains clinical diagnosis. Imaging is only used for atypical cases. Let's take a moment to watch a video illustrating the lived experience of Parkinson's disease. As you saw, the motor symptoms can include bradykinesia, rigidity, postural instability, tremors, and walking difficulties. But the story doesn't end there. Non-motor symptoms like anxiety, depression, apathy, cognitive difficulties, constipation, and disturbed sleep can be just as debilitating as the motor symptom. Imagine facing all these challenges daily. It's not just the individual with Parkinson who are affected. Their caregivers, often spouses or family members, also face immense stress, fatigue, and also emotional burden. The Parkinson's disease journey is complex, stretching from subtle prodromal period to the terminal phase. If you look at the graphic, you can see how the symptom and needs evolve over time. Parkinson is a complex disease, and its effects often go beyond what we can see on the surface. The Parkinson iceberg illustrates how much the struggle lies beneath the surface, unseen but deeply felt by patients and families. Visible symptoms like tremors or movement problems are just the tip of the iceberg. Beneath the surface, people with Parkinson may experience anxiety, depression, fatigue, and many other challenges that are less obvious but deeply impactful. So, what can we do? Supporting people with Parkinson means helping them to maintain their ability to participate in daily life and to self-manage their symptoms as much as possible. Effective treatment requires not just medication, but teamwork across disciplines, with patients and caregivers as partners. This approach empowers clients to manage their own health and lead to a better outcome and also satisfaction. Interdisciplinary collaboration is key to improving quality of life for everyone involved. helping professionals, individuals with Parkinson's, their caregivers, and even the general public. Who are we as helping professionals? We are the counselors, doctors, nurses, psychologists, social workers, auxiliary health providers, behavioral specialists, and health educators. Those who support, empower, and care for others during times of challenge and change. And for us, helping professionals, our work is demanding. We are expected to support, empower, and care for others, often while we are managing our own stress and emotional load. But this work, while rewarding, can also lead to burnout if we are not careful. The emotional intensity of our work can lead to exhaustion, overwhelm, and compassion fatigue. If this stress is left unaddressed, it can sap our energy, affect our mood, and even diminish our ability to help those who need us. Burnout is a state of emotional, physical, mental exhaustion caused by excessive and prolonged stress. It can impact our ability to provide effective care, and is something we need to take seriously in helping professions. Let's take a moment to talk about stress, a reality for almost everyone, especially for those of us in helping professions. To understand stress, I would like to introduce the transactional theory of stress and coping, developed by Lazarus and Fortman. This model helps us to see stress not only something that happened to us, but as a dynamic process, a transaction between ourselves and our environment. According to this theory, stress occurs when we encounter a situation or stressor that we perceive as harmful, threatening, or challenging. But here's a key point. It's not just the event itself that matters, it's how we interpret or appraise that event. Two people can face the exact same situation, but one might feel overwhelmed, but the other feels motivated. It all comes down to perception. Stress arises when the demand of the situation exceeds the resources we believe we have to cope with it. Whether those resources are time, energy, knowledge, or support. Think about a time when you felt overwhelmed at work. Was it because you genuinely couldn't handle the task? Or did it feel like too much because you lacked support or time? For helping professionals, stressor can often be quite specific. They might include challenging cases, rapid advances in technology, communication difficulties, lack of organizational support, long working hours, limited manpower, excessive workload, and the pressure to meet deadlines. These are not just abstract challenges, they are the daily reality that can build up, sometimes unnoticed, until we find ourselves feeling exhausted or burnout. Stress is not inherently negative. When we perceive our ability and resources as adequate in the face of challenges, we experience stress as manageable or even positive, often called eustress. This is the stress that motivates us, help us grow, and keep us engaged. This is where self-compassion becomes so important. Self-compassion is an internal resource that we can cultivate. When we treat ourselves with kindness, recognize our common humanity, and practice mindfulness, we can strengthen our ability to cope with stress. Self-compassion doesn't remove the stressor from our work, but it gives us a stronger foundation to face them, and it helps us to turn inward for support, especially when the external resources are limited. With this understanding of stress and coping, let's take a look at how self-compassion can help us prevent burnouts and maintain our well-being as helping professionals. Self-compassion is about being kind and supportive to ourselves, especially when we are struggling. It's a productive approach that will help us cope with difficult emotions and promotes both physical and psychological well-being. But in many professional settings, especially in healthcare, this idea can sometimes be misunderstood or even dismissed. Here's a little cartoon that captures this attitude. Sometimes it can feel like showing empathy or compassion is seen as something unusual or even as something to be fixed. This cartoon is poking fun at the idea that we should just medicate away our natural emotional responses rather than embracing them. Of course, in reality, empathy and self-compassion are not weakness or symptoms, but essential strength for our well-being and for our work. So, what makes up self-compassion? There are three key components: self-kindness, common humanity, and mindfulness. Let's zoom in on the first, self-kindness, which is the opposite of self-judgment. Self-kindness means adopting a warm, supportive attitude toward ourselves. Instead of beating ourselves up when we fall short, we treat ourselves with care, just like we could treat a friend. That means acknowledging our weaknesses without harsh criticism and offering ourselves the same nurturing support we would give to someone we love. It's about being kind to yourself, not just when you succeed, but especially when you stumble. Let's make it practical. Imagine how you comfort a friend or loved one when they are struggling. You offer them patience, understanding, and gentle words. Now, can you offer that same kindness to yourself? Next, mindfulness versus over-identification. Let's be honest, how many of us have ever made a mistake and immediately thought, I am a mistake? It's so easy to let one bad moment or a single setback define us. But the truth is, people often perceive temporary setbacks as permanent flaws. That's where mindfulness comes in. Mindfulness reminds us that pain and discomforts are parts of the present moment, but they don't define who we are. We don't need to exaggerate or avoid our feelings. Instead, we can notice them, accept them, and let them pass, remembering they are just thoughts and feelings, not facts about our worth. The last component, common humanity versus isolation. Sometimes a deeper thought sneaks in. It seems like others have a better life than I do, and I am the only one suffering. How many of you felt this way at some point? This belief that we are alone in our own struggle is incredibly isolating. But let's challenge that thought again right now. This is not the truth. Suffering, setbacks, and pain are parts of the life for everyone. We just don't always see what others are carrying. When we believe we are the only one having a hard time, we cut ourselves off from the very connection that can help us heal. Common humanities is the antidote to that isolation. It's the recognition of that being human means being vulnerable, imperfect, and sometimes struggling. Every single person in this workshop and every person you meet knows what it's like to face challenges. When we acknowledge this, we create a feeling of connection. We are not alone. We are in this together. And that is a powerful source of comfort and strength. Before we move forward, I would like to share something that beautifully captured the essence of common humanity. This is a poem reportedly written by a woman who spent her final days in a geriatric ward of a hospital in Scotland. After her passing, the staff found this among her belongings. They were so moved that they made copies for every nurse in the hospital. Although it was addressed to nurses, it is, in truth, a message for all of us, a call to see the whole person, not just the patient or a problem in front of us. There is no record of her name or when she died, but her words live on. I invite you now to listen not just as professionals, but as fellow human beings.
What do you see, Ness? What do you see? What are you thinking when you look at me? A crabby old woman, not very wise, uncertain of habit with far-away eyes, who dribbles her food and makes no reply when you say in a loud voice, "I do wish you'd try." Who, quite unresisting, lets you do as you will, with bathing and feeding, the long day to fill. Is that what you're thinking? Is that what you see? Then open your eyes. You're not looking at me. I'm a small child of 10. A bride soon at 20. My heart gives a leap, remembering the vows that I promised to keep. A woman of 30. My young now grow fast, bound together with ties that should last. At 40, my young sons have grown up and gone, but my man stays beside me to see I don't mourn. Dark days are upon me. My husband is dead. I look at the future. I shudder with dread. I'm an old woman now, and nature is cruel. 'Tis her jest to make old age look like a fool. The body, it crumbles. Grace and vigour depart. There is a stone where I once had a heart. Inside this old carcass, a young girl still dwells, and now and again my battered heart swells. I remember the joys, I remember the pain, and I'm loving and living all over again. I think of the years all too few, gone too fast, and accept the stark fact that nothing can last. So open your eyes, nurse, open and see, not a crabby old woman. Look closer, see me.
This poem is a powerful reminder that every person we care for has a rich, complex story. Beneath the illness, beneath the symptoms, is a whole life filled with dreams, struggles, and love. When we embrace common humanity in our work, we move from seeing cases or tasks to seeing the person in front of us. This poem reminds us to look beyond the surface, to see the whole person in front of us, not just a diagnosis or a list of symptoms, but in our daily work, it's easy to slip into thinking of clients as just another case, a task, or a problem to solve. But what if we made a conscious shift? What if we remembered that every client is first and foremost a human being just like us, with hopes, fears, and a unique life story? And if we can see others as human, it's equally important to treat ourselves with that same compassion. Self-compassion isn't just about preventing stress. It's a vital way to cope with trauma and transcend it by using the therapeutic use of self. This connects to the theory of wounded healer. When an individual's coping is ineffective, the impact of the trauma is unrecognized. The pain remains unresolved. This individual then function as a walking wounded and experience problems in their social, intimate, and work relationships. In denying their own conflicts and vulnerabilities, this individual projects their woundedness on both patients and colleagues while considering themselves unharmed, yet being less able to empathize with others. If trauma is dealt with effectively, the pain is consciously recognized, transformed, and transcended into healing. Although injury has occurred, the wounds will have been sufficiently understood, processed, and will not interfere with providing care. This processing ultimately leads to healing. Despite the remaining scar, this pathway to healing leads the nurse to become a wounded healer, and allows the nurse to draw his or her woundedness to provide the service of healing. Conti O'Hare developed the theory of the nurse as wounded healer to explore the nurse's ability to transcend personal pain and suffering, to build better therapeutic relationships with clients. It also applies to other professionals. Self-compassion is at the very heart of this process. It's what allows us to move from woundedness to healing, both personally and professionally. But sometimes there are misunderstandings about what self-compassion really is. Let's take a look at some of the common myths and misconceptions that can get in the way. First, some people worry about self-compassion is just self-indulgence. But actually, self-compassion doesn't mean spoiling ourselves. It's about making healthy, caring choices for our long-term well-being. Is self-compassion selfish? Not at all. In fact, it helps us connect to others, forgive mistakes, and build stronger relationships. Some fear self-compassion will make us lazy or unmotivated. But research shows the opposite. It actually helps us stay motivated using encouragement rather than harsh criticism. And finally, is self-compassion weak? No, it's a real source of strength, giving us resilience and helping us take a stand against harm. In fact, self-compassion builds what called compassion resilience. This is our protective shield against the negative effects we might experience from witnessing suffering day after day. Compassion resilience is the power to return to a place of empathy, strength, and hope, even after we have been exposed to the challenges and pain that others face. Is what allows us to continue feeling optimistic, to keep caring, and to maintain our sense of purpose even in an imperfect world. But compassion resilience is more than just bouncing back or returning to how things were before adversity. It's also about our ability to positively adapt to difficult situations. Adversity doesn't just knock us down, but it can also help us grow. True compassion resilience means we don't just survive challenges, but we find ways to change and grow because of them. In other words, we can become even stronger, wiser, and more compassionate through the very experience that tests us the most. However, while personal resilience matters, we also have to acknowledge that it's not fair or realistic to expect individuals alone carry the whole burden. Organizational climates, workplace conflicts, and ineffective leadership all play a huge role in our well-being. Individual resilience is important, but it's not enough. We need moral courage and collective action. That's where the development of resilient teams comes in, by increasing self-compassion among team members. So how do we actually build resilient teams? We take a look at the process. People may wonder, is self-compassion just a fixed personality trait or something that you either have or you don't? Actually, self-compassion is not just a personality trait. It's a skill that can be learned and practiced, especially through metacognition. Metacognition is all about being aware of how we think. You can think of it as thinking about thinking, or even being aware of your own awareness. Metacognition has two main dimensions. First, there's metacognitive knowledge. This refers to our understanding of our own cognitive abilities, knowing what we are good at, what challenges us, and what strategies we can use for different tasks. It also include knowing when and how to apply those strategies. Second, there's metacognitive regulation. This is about actively monitoring and managing our thinking processes. It means keeping track of how we are doing, making adjustments along the way, and choosing the best approach to help us reach our goals. Both of these aspects help us become more effective learners and problem solvers, and they are essential skills for personal growth and professional development. Metacognition operates on two levels. The object level, which is our basic thinking or cognition, like reading or problem solving, and the meta level, which is where we step back to monitor or control what's happening. For example, while you're reading, you might stop and ask yourself, do I really understand this? That's monitoring from the meta level. If you realize you don't understand, you might decide to reread the paragraph or slow down to make sense of it. That's control in action. This ongoing process of checking in and making adjustments is what helps us learn more effectively. And this is a skill we can develop and strengthen over time. As helping professionals, metacognition is one of the most essential mental abilities we can cultivate. By understanding how to shape and improve our own thinking, we become more thoughtful, reflective, and effective in our practice. This means we don't just react on autopilots. Instead, we make better decisions, act on well-reasoned conclusions, and bring critical thinking to our own professional judgment. Ultimately, metacognition helps us stay sharp, intentional, and compassionate in all that we do for those we support. So, self-compassion can become a habit if we use metacognition to analyze and evaluate our thinking, and then practice regularly. There's practical programs that can help us develop self-compassion, like compassion-focused therapy for clinical populations and mindful self-compassion program for non-clinical population. And let's take a moment to experience self-compassion practice together right here. We will start with the self-compassion break. This practice will explore three components of self-compassion and demonstrate how language can invoke feelings of self-compassion. So let's warm up first. Please take a moment to find a comfortable posture. If you notice tension in any parts of the body, feel free to stretch or move gently to help relax. If you may close your eyes or you keep them slightly open if you feel comfortable to do so. Feel your body in your seat and allow yourself to settle into the present experience. When ready, take a few deep breaths. We are going to practice self-compassion break together. Take a moment to notice how you are feeling right now. Bring your attention to your body. Notice where you feel the discomfort. Is it in your chest, your stomach, your shoulders. Just observe without judgment. Now, say to yourself slowly and kindly, this is a moment of suffering. If that phrase doesn't feel natural, you can say, this hurts, or this is stressful. Now, remind yourself that whatever you are feeling is part of the shared human experience. Say to yourself, suffering is part of life. Or you can say, I'm not alone. Others are just like me. Or, this is how it feels when a person struggles in this way. Now, offer yourself some kindness. Say to yourself, may I be kind to myself. You could also say, may I give myself what I need? Or may I accept myself as I am? Or may I learn to accept myself as I am? May I forgive myself? May I be strong? May I be patient? May I live in love. If you're struggling to find the right words, imagine a dear friend or loved one is having the same problem as you. What would you say to this person, heart to heart? If your friend were to hold just a few of your words in their mind, what would you like them to be? What message would you like to deliver? Now, can you offer the same message to yourself? Now, take one more deep, gentle breath. Breathe in and out. If your eyes are closed, you can slowly begin to open them. Bring your attention back to the room, noticing any sounds or sensations around you. Take a moment to notice how you feel after offering yourself this compassion. Thank you for taking this time to care for yourself. Let's have some time for reflection. How did that feel for you? Did you notice any changes in your body, such as softening, warmth, or tension easing? What was it like to acknowledge your suffering and offer yourself kindness? Did it feel comforting or perhaps a little bit challenging? Notice how you feel now compared to when we start. Do you feel calmer, more grounded, or just a little bit more at ease? Any inspiration? Now, we have another practice time, exploring giving and receiving compassion. This practice involves compassionate listening and prevents burnout and fatigue. There are 3 parts: savoring the breath, warming up awareness, in for me, out for you. Let's find a comfortable position. To begin with, now please sit comfortably. Close your eyes if you feel comfortable doing so. Place a hand over your heart or another soothing place on your body. Notice how your hands feel against your body. Bring not just awareness, but loving awareness to yourself. Take a few deep breaths. Notice how your in-breath nourishes your body. And notice how your out-breath soothes your body. Now, let your breathing find a natural rhythm. As you breathe in, imagine you are breathing in kindness and compassion to yourself. Feel the warmth of the in-breath as if it's carrying kindness directly to you. On the out-breath, imagine releasing any tension or stress. Let your breath gently rock you like the rhythm of the ocean. Now, Bring to mind someone you love or someone who is struggling and needs compassion. Visualize this person clearly in your mind. As you exhale, imagine directing kindness and compassion towards them. With every out-breath, send them ease and comfort. Now shift your focus to both your in-breath and out-breath. As you breathe in, say to yourself, "In for me." As you breathe out, say to yourself, "Out for you." You can adjust this balance if it feels right. For example, 2 for me, 1 for you, or 1 for me, 3 for you. Let the breath flow naturally, like the gentle movement of the sea. Feel this limitless, boundless flow of compassion, flowing in and out. When you are ready, gently open your eyes. Take a moment to notice how you feel after this practice. What did you notice about your breath? How did it feel to breathe in for yourself and out for someone else? What was it like to send compassion to someone else? Did it bring a sense of connection or balance? How are you feeling now? Do you notice any shift in your mood or emotions? Perhaps feeling more at ease or connected? Remember, there's no right or wrong way to experience these practices. Whatever you notice is okay. If you felt discomfort or resistance, that's natural and is part of cultivating self-compassion. Be gentle with yourself as you continue to explore these practices. Over time, with practice, self-compassion can become a more natural and spontaneous response to life's challenges. Feel free to revisit these practices whenever you need to reconnect with yourself or bring compassion to daily life. Keep in mind, compassion isn't just for others, it includes ourselves. In fact, to help others effectively, we must begin with self-compassion and then expand outward. To people with Parkinson's, caregivers, and general public. Based on the integrated body-mind-spirit model, our mind, body, spirit are interconnected. Achieving balance among these three key elements is crucial for enhancing our health and overall well-being. Embracing this balance can lead to a more vibrant and fulfilling life. Self-compassion can promote an individual's spiritual growth and positively impact their general well-being. Research shows higher self-compassion leads to less depression, anxiety, and stress, especially in people facing difficult conditions. Self-compassion in caregivers of people with chronic illnesses is associated with improved emotion regulation and more effective stress coping strategies, as well as reduction in caregiver burden and psychological distress. For the general public, people with higher level of self-compassion are less likely to experience mental health issues. This happens because self-compassion enhances emotional regulation and reduces negative thinking pattern and distressing emotion. As helping professionals, we should notice that although compassion is a good intention, it isn't equal to professional practice, especially when we are overly compassionate to our clients. What is the problem of being overly compassionate? Compassion fatigue can significantly impact our emotional well-being and manifest in various ways. Individuals may find themselves hyperarousal, characterized by disturbed sleep patterns, irritability, heightened sensitivity, leading to outbursts of anger. This state often overlaps with a desire to avoid triggering situations or conversations, reflecting a profound sense of avoidance as coping strategies, coping mechanism. People may re-experiencing symptoms such as intrusive thoughts or distressing dreams, which can intensify feelings associated with the past events. While compassion is essential in fostering trust and connection with clients, being overly compassionate despite professional boundaries will harm ourselves and our client. This will affect our mental and physical health and can also compromise the quality of care we provide. Therefore, it's important to clarify that helping relationship between us and our clients, and to define the elements, purpose, and ethics of your field of professional practice. After you have an awareness of your roles and responsibilities, you can prevent crossing the boundaries while being authentic and caring. Let's wrap up some key takeaway messages from today's session. Both the motor and non-motor symptoms of Parkinson disease can significantly decrease the quality of life of patients and their caregivers. So that's why we need strong interdisciplinary collaboration among helping professionals to truly address their care needs. To become effective helpers, we have to start by taking care of ourselves, specifically by practicing self-compassion. When we do this, we gain the internal resources to cope with the burnouts and help us help our clients using the therapeutic use of self. Remember, self-compassion isn't just one thing. It includes three essential components: self-kindness, common humanity, and mindfulness. Together, this helps us see ourselves objectively and treat ourselves with understanding. Ultimately, self-compassion is a skill we can learn and practice, not just for ourselves, but to expand outward and offer compassion to others. And while we are maintaining healthy professional boundaries. Here are the references if you want to explore any of the concepts further. And thank you very much today to listen to me and practicing self-compassion together.